Good afternoon, good evening from wherever you may be joining. My name is Joud Sajdi. I'm the Managing Director of Sama Consulting, and I will be the facilitator for you this evening. So just a few housekeeping notes. We are going to be speaking in English and Arabic today. If you see at the bottom of your screen, you will see the globe icon right next to the more icon, and there you can select the channel with the language that suits you, English or Arabic. So that's to start with. If you do have any questions, concerns, technical issues, please feel free to drop us a note in the chat, and one of my colleagues will get back to you. Today we have a very interesting session. We will be presenting findings from a study conducted by Development Pathways as part of the Shamil program and in collaboration with the Information and Research Center of the King Hussein Foundation. We do have some speakers with us from the study team, as well as some guest speakers today. We have a portion for questions and answers right at the end of the webinar. So if you do have any burning questions, any notes, please keep those until the end, or you can just drop them in the chat and we can get to them as soon as we get to our questions and answers segment of the webinar. So just to start with, we have our guest speaker, Dr. Haytham al-Zarbi, who is the Director of Planning and Research Department at the National Council of Family Affairs here in Jordan. Dr. Haytham, thank you so much for being with us today. Dr. Haytham is leading pioneering work in expanding childcare services in Jordan, and especially in rural areas. So please, without further ado, the floor is yours.
Thank you, Jude. Good evening, everyone, and good morning for some. It's my pleasure to welcome all of you to this important webinar, Childcare Pays in Jordan, Return on Investment Results and Policy Pathways. On behalf of the National Council for Family Affairs and our partners, I thank you all for joining us today. Today's discussion could not be more timely. Jordan is a pivotal moment in advancing women's economic empowerment and strengthening our care systems in Jordan. We are here to talk about why investing in a child care now is so critical for Jordan's future and how this new study fits in our national policy priorities. Let me start with the context that brought us here. We all know that Jordan has a long struggled with low female participation in the workforce. Only about 17.6% of women are economically active, among the lowest rates globally. One major reason is no secret to any of us: the lack of affordable, reliable childcare. In fact, over half of Jordanian mothers with young children say family responsibilities, mainly childcare, are the reason they cannot work. This is striking statistics that should give us pause. It means tens of thousands of talented, educated women are staying home, not out of choice, but due to caregiving duties. Jordan has nearly 1.3 million children under 5 years. Yet, licensed childcare facilities serve less than only 30% of them. The rest of the care is provided informally, overwhelmed by mothers. Women in Jordan shoulder that vast majority of unpaid caregiving, often spending 7 to 9 hours a day on a child care on the top of any paid work, essentially working a double shift of 12 to 14 hours. These realities have huge implications. This unmet need for childcare not only limits women's incomes and careers, but also presents substantial lost economic potential for our country. The good news is that there is growing recognition in Jordan that this has to be changed. Our leadership and policymakers are increasingly treating childcare as an essential infrastructure for our economy, not just a private family matter. In recent years, we have seen momentum build, new policies, strategies, and a partnership, all aiming to improve care provision. For example, in April 2024, the government, through NCFA, the National Council for Family Affairs, with the support from development partner like the IRC, the Canadian government, like BVLF, finalized a national childcare policy outline. This policy framework focuses on expanding access, including through subsidies and grants, improving quality standards, and ultimately easing women's care burden so they can participate more in the workforce. These efforts, again, closely with the Jordan's national vision, our economic modernization vision, and other reforms, such as extending maternity leave. In short, childcare is now family on the national agenda as a key enabler of women's economic empowerment and family well-being. Yes, despite the momentum, we are still not where we need to be. Major barriers remain that we have to confront. The cost of a formal childcare is still prohibitive for many families, often eating up a large share of a mother's wages or salaries. Availability is even outside of Amman and a few urban centers. Quality nurseries are scarce. We have laws like Article 72 of the Labor Code, which requires employers to provide daycare if enough employees have a young children. But compliance has been weak and enforcement is lacking. Then there are social factors. There are social factors and cultural expectation that mothers should be in the caregivers and concerns about safety or quality of daycare. Survey, the survey shows only 60% of mothers say that they don't trust formal childcare providers, reflecting the need to ensure quality services together. These cost, access, and trust barriers mean that even the policies we have in place haven't yet translated into widespread use of childcare services in Jordan. This is precisely why this study is so timely. We have a policy vision and we know the challenges. Now we need evidence-based solution to guide action. Until now, much of our conversation about childcare has been about why it matters. We, we have all felt intuitively and seen from global experience that investing in childcare yields great benefits for women, for children, for the economy. But we lacked concrete data of Jordan to move from broad advocacy to practical policy design. The decision makers need clear metrics, truly money in versus money out. Look at childcare as an economic investment. Just as importantly,
Beautiful take.
the study that will presented today provides evidence on questions Jordan officials are actively debating. Should we invest in public daycare centers, subsidized childcare in the private sector, or pursue a combination of both? If we only have a limited resources to start, where do we get the biggest bang for our dinar? These are real, pressing questions, especially as Jordan finalize our childcare policy and looks to implement it in the coming year or the coming years. Let me emphasize the timing could not be better. We have one on we have on one hand a clear national commitment to improving childcare. It's written into our strategies and reform. On the other hand, we have resistance gaps on the ground. Now we also have a new data and analysis to bridge the two. This study is evidence meeting opportunity. It's going to help us turn good ideas to effective action. By quantifying the returns to investing in childcare, it effectively makes the case that the childcare is not a luxury or a side issue, but a smart economic investment for Jordan. As the report shows, childcare expansion can pay for itself over time by boosting jobs and tax revenues. In addition to all the social benefits, in the other words, childcare pays, and not just in the long run, but in fairly tangible ways that matter for our budget and economy. Today's webinar is about unpacking these findings and discussing the policy pathways in front of us. Our goal is to complement the detailed report with a broader conversation. How do we take these insights forward? How do we craft policies that maximize the impact of women's employment on children's development, on Jordan's inclusive growth? We will hear from the researchers who conducted the analysis, and thank you for them all, and we will reflect on what it means from a labor market and gender lens. We have a fantastic lineup of speakers and participants, all of whom have a stake in this issue. As we begin, I want to leave you with this thought. Investing in childcare is ultimately about investing in our people and our future. It is about enabling parents, especially mothers, to fulfill their potential in the economy while ensuring our children get quality care in their early years. It is about sharing responsibility between families, the state, employers, and communities to build a care system that works for everyone. And it's about recognizing that women's empowerment and family well being go hand in hand. Jordan stands to gain tremendously if we get this right in a greater prosperity, in stronger families, and in a more equitable society. Thank you once again for being here and for your commitment to this cause. I'm truly excited to hear the insights from the study and the discussion that we will follow. Let's use this opportunity to chart a course towards a more caring, more prosperous Jordan. With that, I will hand over to our researcher or presenters to take us through the return on investment findings, and thank you all.
Thank you so much, Dr. Haytham. And as you said, the findings of this research are very timely, especially that there is high political interest in expanding quality and accessible childcare services here in Jordan. So to present the research findings, we have two economists. We have Tanima and Mari, who are economists by background, and Tanima is the study team lead, and Mari was the economist on the study. So I will give Mari a minute to upload the study presentation before we start.
Thank you, Jude.
Tanima, can I just ask you to expand the
Can you hear
screen?
me?
Yes. But just to click on the presentation icon so that we can see the full presentation.
I have done it. I think it will come pretty soon. Or let me do it again. But can you see the full screen now?
Yes, we can see the full screen and the floor is yours. We actually lost the screen. If you can, maybe we lost you, Tanima, for a second.
I'm sorry, I lost connection. Yes, I lost the connection. I'm back again. I'm sorry.
No problem.
Can you see it now? I think it should be.
We can see your screen. The floor is yours.
Yes, thank you. Thank you. Hi, everyone. Thanks for joining us here in this discussion. It's my pleasure to present the findings. I'm Tanima Ahmed, and I will present the study objective, and later my colleague Mari will present the methodology to you. So this study is about the return on investment of childcare services that I have already put together. As you know, that female labor force participation in Jordan is pretty low. As you heard, it's 17.6% compared to the worldwide, it's 48%. And childcare has always been a barrier. 56% of Jordanian women with young children cited childcare as the main reason they cannot work. And although there are many children, yet there are only less than 3% of them who can go to nurseries. So the gap is pretty obvious when it comes to childcare. And as you know that women perform most of the childcare, right? The unpaid work. It's 80% of unpaid work are performed by women, where mothers generally spend 7 to 9 hours a day on childcare, especially when the mothers are working. It goes way above. It's 12 to 14 hours. So of course, this is a responsibility that stops mother from going and participating in the labor market. And what we really call, coming down to, it's a motherhood penalty, right? Global studies have always shown that employers are less likely to hire mothers and often offer them lower salaries due to caregiving responsibilities. And especially in MENA, that you can see a lot more when there are limited childcare and few family support policies, means that motherhood related career hurdles are even higher because you do not have flexible workplace policies, you do not have childcare available. So of course the penalty is way higher than what you can see in maybe other countries. Women often either withdraw entirely from the labor market, or they may look for jobs which has flexibility, or which have more, are part-time, so that they can really take care of their children. Cultural expectation, of course, is very strong, what we call norms. As you can see that mothers, stay-at-home caregivers, it's an expectation. And in MENA, as we already mentioned, that you can see for that, the labor force participation has been pretty low at 17.6%, whereas men's labor force participation is 70%. The gap is really wide. So there is a policy momentum. Dr. Hatham already actually discussed about it. There is a policy momentum in Jordan. Leaders are increasingly treating childcare as essential infrastructure. Government is prioritizing it. We have in 2024, a National Council for Family Affairs released a national childcare policy outline with support from IRC to expand access via subsidies or grants, improve quality standards, and basically reduce women's childcare responsibility. There is also a national strategy which goals and recent reforms, extended maternity leave to boost women's economic participation. We also can talk about enforcement. Law is existing. Article 72 is requiring employer to provide childcare. But despite those momentum, we still see formal childcare remains unaffordable for many, and availability is also quite uneven. So that's still an issue in Jordan. So in this study, the objective has been to assess the return on investment of providing childcare, to kind of quantify that if we expand the childcare and provide it for children 0 to 5 years old, what will be the benefit and what will be the cost related to it, right? And we compared the delivery models, right? Childcare can be provided, but childcare can be provided in different models. Either government can provide it through subsidy, or the government can establish their own centers, which is more like a supply side, and provide it. And we have seen it in many countries, in many different models, childcare can be provided. So we kind of compared the models, like what works for Jordan really, and for each model, what will be the return on investment, which direction Jordan should go, given this return on investment. And in a way, we are informing the policy design. As we know that childcare is important, but the question comes, how do you really provide it? So the policy design matters when it comes to providing childcare. So we kind of look into it in this study in detail. And coming to global evidence, we have not many for Jordan, but there was a UN Women study which has seen in Jordan that spending on childcare would outperform equal spending on construction in terms of job creation. Because when you provide childcare, it's not only that mothers will go to labor market, but it's also that you are creating jobs through childcare centers, direct and indirect, in a way. So it will help, if you provide childcare, it will help narrow the gender employment gap. There are also other studies which was done by World Bank in 2023, which has shown that if you provide affordable childcare, the female labor force participation can increase by 2.5 percentage points. And that's way more if you provide childcare as free. Global studies have also pointed that out, that there are millions of jobs that can be created just providing childcare. And it's not only an expenditure, it can come back through taxation, right? If women are going to the labor market and working, the tax basically kind of helps in paying it off. So where are we adding in this study? What we're trying to do is, although there are studies in Jordan, but what we're trying to do is we're trying to look into specific models. And this is, to the best of our knowledge, this is the return on investment. This is the first return on investment for childcare in Jordan, where we're looking into money in versus money out. We are looking into societal and fiscal benefit cost ratios to say how much you will get if you spend one GOD. So the direct model comparison, we're doing a demand side subsidy approach against a public centered approach. We are comparing both the models and seeing, as I said before, that which works for Jordan. We are also bringing in the phased implementation. As you know, we want to look for universal childcare, right? You want to cover everybody, but it cannot happen overnight. It needs planning, it needs rollout over time to gradually basically reach out to all the mothers and all the children. So we kind of looked into the phased implementation to make it more realistic, our calculation, and we tried our level best to use Jordan specific data. Of course, it's very difficult at times to find those parameters or numbers, but we tailored it to the Jordan data as much as we have been able to. So before we move on the methodology, just to provide a kind of conceptualizing the provision of childcare, like how childcare in a society is provided. As you can see, this is a care diamond, we call it. There are four kind of stakeholders that can provide childcare. One is the families, which we see that women are providing childcare. Another is you can have market providing childcare. You can have state or government providing childcare, and you can have not-for-profit providing childcare. As you already know, if families are providing childcare, you can see that women are not participating in the labor market. If market is completely taking the responsibility of providing childcare, it might not be affordable, or it might not be available enough for the families to get it, or the quality can also be an issue. So where we are coming from is we are saying that state should provide childcare and help women to participate in the labor market, reduce the burden for the mothers. The policy goals, no matter how you provide it, the policy goals are to expand access to childcare by promoting diverse types of solution. Not everything will one size fits all. Maybe some people will prefer, some families will prefer to use it through workplace childcare. Some will prefer to use it through community-based childcare. Some will prefer to use different models. So it's important to expand the access to childcare. Ensure the childcare coverage for the most vulnerable families, for the especially low-income families who cannot afford childcare. That's very important that we have universal childcare, free childcare reach those families. Allocate sufficient financing to make quality childcare more affordable and available. Define clear workable institutional arrangements. Of course, the ministries needs to coordinate to make it happen, and the system needs to be there. And the quality is very important as well. We need to have safeguarding. You need to have stimulating environment. Do no harm, especially because children will be using those childcare centers. So basically, it's what we're saying is government should ensure that childcare is available and affordable and of decent quality that meets the needs of all families. So from here, my colleague Mari, who is actually run the methodology, will take over. And Mari, over to you for the methodology of the return on investment. Thank you.
Thank you so much. I will now go through maybe the sort of paper, kind of the number crunching part of this study. So the methodology that we apply is cost-benefit analysis, which I'm sure you have all heard once or twice before. Basically, the idea being that any policy that we introduce obviously has immediate costs and maybe has a very short-term benefits as well, but this is not really adequate to properly assess whether it's worthwhile, because in the long term, there are more costs and more benefits. And we have to have a way of quantifying these long-term costs and benefits, which is done by discounting. Obviously, something that happens far away in the future, it can be considered as somehow like less valuable in some ways, or it has to be taken into account that there's time that you have to wait to receive it. In the same vein as a private sector company that needs to borrow money has to take into account that money has different uses and there's an interest to pay. And our primary metric is the ratio of all those benefits brought to today against the cost that we also calculate as the value of today. Now, there are two lenses that we apply. First, societal perspective. We can assume that any policy has impacts, things happen that would not have happened otherwise in the whole society. I guess sort of in its crudest, we talk about GDP growth, which of course is all very well and is important, and often there are big benefits all over the society, which may be very difficult to afterwards to confirm that they were caused by this policy, but that they are there. The counterfactual would have been very different. And this is, of course, what all policymakers, first and foremost, should worry about. But at the same time, one needs to be realistic. Public policies are paid out of government coffers. And hence, we also look at the fiscal perspective, meaning that we compare revenues to the government through taxes and social insurance payments against the costs of the policy, the actual cost that the government is paying to implement the policy. Can you change? Tanima, can you move to the next slide? Okay. And basically, another important thing about cost-benefit analysis is not just that we calculate for one policy, which is interesting, but again, the strength of this approach is also that you can compare different ways of doing things, and that way you can see which one in the long term would be the most beneficial. And in our case, we have three different scenarios. The first one was like the simplest. Two first ones are vouchers, and the third one is a model where the government actually builds childcare centers. specifically a sort of center-based approach to childcare. The first scenario, I mean, the difference between the first and second voucher scenarios, okay, the idea is that you provide women a voucher and, you know, they use it. I mean, the cost is only realized when they actually use it. They purchase childcare services from a private provider, and then subsequently they join the labor force. Note, we don't assume that they necessarily immediately get employed, but they join the labor force and they, at a certain rate, they become employed, they start earning and paying taxes, and if employment is formal, social insurance contributions. The difference between the two voucher scenarios is that the first one is the simplest one, where we just assume that women, you know, we compare to childless, unmarried women's labor supply, and we just assume that, you know, labor supply of mothers goes to the same level as it would have been for unmarried women with same characteristics. And these women join labor force and then become employed, and all children under 6 can get to care. So it's mothers of children under 6 who get the voucher. The second is a bit different in the sense that we think that the age of the child makes difference. The vouchers are not used as actively when the children are very small, under 2 years of age, and then, you know, the use goes up for children of 2 to 5 year olds, and effectively, I mean, this is sort of the core group that then benefits from them. And the third one, like I said, calculation involves building gradually childcare centers to cover all children of these age groups, or not all, but certain percentage of children of these age groups. In the last one, there's also the distinction between small ones where we don't assume that there's a need to cover all of them, and then the oldest children for whom 80% would be covered by childcare. And then can you change to the next slide, please? And something that is very important here. Okay, scale up. We actually do provide the vouchers in scenarios 1 and 2 to everyone, but what happens in all of these scenarios is that there's a certain persistence of women's labor force participation, meaning that even after the last child outgrows that age group where childcare is provided, they go to school, that labor force participation and employment that has been taken up prior remains not 100%, but these women will continue to work at a fairly high rate. And for me, like, this is maybe the sort of one of the most important long-term benefits of this, in the sense that with public policies, we often talk about like changes in attitudes and things like that, which are so notoriously difficult to predict or quantify. But I think we can reasonably expect that if once a mother has started working, they've seen the benefits of it, the household sees the benefits of it, and they learn to work their way around these care duties, maybe divide them more evenly within the household, and hence like this labor market impacts go on until the end of the woman's working life. Then there are also these economic impacts, which often come through in these, are often included in various economic models, meaning that, okay, we create employment in childcare centers. That itself is, of course, it's a cost to someone and benefit to those who are employed. So that alone is not yet the pivotal thing here. but we assume that there's an economic multiplier, meaning that the extra job creation also has these sort of spillover impacts in the whole economy. One of the caveats, which there are several, of course, as always with economic models, is that we do not assume that these vouchers displace sort of existing childcare arrangements, which of course is always a concern in public policies. I mean, they trigger impacts, but they should be like new impacts and not just replacing something that is already happening. It's of course in labor market. Any labor market policy, you subsidize employment. What if the person who takes it up would have been employed anyway? So we don't assume that there's just a switching of, possibly informal or already formal childcare to this user voucher, but no impact on that would kind of reduce the impact on women's employment. Can I have the next slide, please? And these, of course, are the key benefits that we don't really, I mean, we can't quantify, I mean, all of these sort of knock-on impacts which such policy would have. But of course, main thing is that mothers are able to work, their time is freed for working, which then generates labor incomes, which then translates into fiscal revenues. There's the direct employment of childcare sector jobs as discussed, but basically the main benefit, the extra benefit from that comes through spillovers or indirect impacts of the economy. And can I have the next slide, please? And what we found was that with all these assumptions, I mean, vouchers, I mean, generated very significant impacts. I mean, societal benefits actually in all these scenarios were very high, and that's wonderful. But of course, I think from a policy perspective, what is the most important thing that also in terms of fiscal return on investment or benefit to costs, the voucher schemes had well above 1, meaning more benefits than costs in terms of these fiscal benefit to cost ratios. And the interesting thing was that the public provision had somewhat more modest benefit to cost ratios. The societal one was still well above 1, but the fiscal benefit to cost ratio was kind of hovering at 1, or, obviously it all depends on how you change the assumptions, but it was not nearly as, I would say, clearly positive, or was even sometimes like below 1, like I said, in the basic scenario, meaning that there's much less certainty that the government will recover the costs of this scenario. Can you move to the next slide, please? There's also a timing issue. So I'm just moving this window. This graph shows every year, like what cost and benefit incurring in a certain year. For the voucher schemes, it already starts from number 1, and then it goes higher and higher and higher. Obviously, like once we calculate the overall benefit to cost, the benefits that occur in 18 years or 10 years time, they will count less because they have been discounted. Even for the center-based scenario, at certain point, the benefit to cost ratio exceeds 1. And I think these effects, the sort of the time profile, very much hinges on these labor market persistence impacts, meaning that more and more women who don't need the voucher anymore, they still work. And that is like the sort of, I think for me, as a key long-term benefit, I think that would have to be like the aim of something like this, ultimately, as a government policy. Can I have the next slide, please? These numbers, they're maybe not that interesting as numbers as such, because they are not something that government would pay this year or receive this year. No, these are the overall discounted costs and benefits of these different policies. But as you see, I mean, it kind of shows you how the societal benefits, they're very high, and the height of the two other, the fiscal benefits, which is a purple bar, and the cost, which is a red bar, how they balance in different scenarios. Like we see in the public center scenario, they, as I said, actually the costs are a bit higher, whereas in the two other scenarios, there's still a significant difference, significantly higher benefits than costs. And the next slide. Now, I mean, of course, like all models, this has a lot of assumptions, and it's worthwhile discussing how changing each assumption might change the outcome. So we did some sensitivity tests. Uptake itself, I mean, how many women actually decide to use childcare, it doesn't really impact on the voucher scenarios that much, because obviously the cost is only realized when the woman actually takes up the voucher. But this is kind of essential for the childcare center model, of course, because the investment into the care centers needs to be done anyway. So low uptake deems more and more costs as like sort of not generating returns. Employment outcomes is obviously something that I'm sure like is a big uncertainty here, and it's not really necessarily up to the women themselves. I mean, this is something where what happens in the labor market if we have all these women joining, what happens in the economy in general. But we still had somewhat like decent break even in the voucher models if we reduced employment probability. Now, of course, this is just a subsidy. In the voucher models, we did not assume that the voucher needs to cover the full cost of childcare. I mean, this is not the case. It's not always the case. We're just talking about subsidy. So, of course, changing the voucher value will change the outcome. But again, having a higher voucher value would still, at least up to a point, generate higher than 1 benefit to cost ratio. Of course, you can always have a hypothetical scenario where you put the voucher value so high that it eats up all the benefits. But I mean, this is something obviously where, policymaker has to make that judgment. This is, of course, also one thing where we unfortunately did not have, from the Jordan context, a lot of actual evidence from pilots or sort of scale-ups, like what would be the required voucher value, though we obviously had some of these data that has been collected in the past years by ourselves. The last caveat is obviously a tax revenue. We included, in the basic scenario, we had social security payments and taxes. Now, of course, this is something where we should I mean, so social insurance contributions are not exactly the same as tax revenues because their spending is more limited. But at the same time, even with somewhat lower returns to the government, the benefit to cost ratio would still be over 1 in the voucher scenarios. And then the next slide.
Mary,
I'm coming to the end of, yeah, exactly. I think I already discussed some of these while I was talking, so maybe I'll hand back to Tanima. I mean, there are a lot of uncertainties, of course. We have reported them in the paper, and we can talk about them. I'm sure people have a lot of questions about them specifically. So I hand back to Tanima to finish the talk.
Thank you, Mari. So basically, as Mari has said, there are a lot of limitations, of course. Our estimates are conservative. We have other assumptions that Mari has already touched upon. So going forward, so as we concluded that voucher actually pays, voucher is actually more important than, I mean, if you compare both of the models, the demand side and supply side had a positive return on investment, where voucher actually pays more as return than the other model of supply side. And why that's so? So one of the things is voucher only expand funds when a service is delivered, right? It can automatically adjust if there is no demand or if the uptake is low. Then of course you are not giving vouchers or subsidy to those mothers. You are not really having those expenditures. So pay for use efficiency. As much as you use, government needs to pay you. If you don't use, government doesn't need to pay. Faster scalability, of course, because you are not setting up a centers or renting it or need to hire childcare providers, etc., etc. So demand side subsidies can scale up very quickly. Because it is relying on the market. The higher the demand, the market will automatically, we assume that market will basically adjust to that demand. So money flows where the families would like to enroll their children. And it will actually expand organically. Lower fixed cost, of course, because as we said, in the public centers, we need to set up the centers. The government need to set up the centers, which is not true for the voucher system. It's basically a subsidy, and the private sector basically operates. Incentive aligned in a voucher system. The incentive it is basically if the parents wants it, it can be given, and the better quality actually needs to be ensured. That's one thing, and government's role is to set standards and ensure that the quality is delivered, and the robustness to real world variability. If the take-up is low, voucher can adjust way faster than if the government is setting up the childcare centers and trying to influence mothers or others to use it, really. So the other important issue is we are basically saying that we should prioritize vouchers for expansion. The policy implication is the evidence strongly indicates that Jordan should lead its childcare expansion through voucher system more than the supply side. The target for quick wins, as Mari was actually explaining, we have shown 3 scenarios, right? One of the middle scenarios were to age targeted, right? So target scenarios might give us more return. So we can look into that for quick wins because maybe the children who are older, their mothers will be using it more than the children who are much more younger. Vouchers as the engine, public centers as a backup. Even though voucher is implemented, public centers can come as a backup because as it's a market driven, right? So there are many underserved areas that can happen in remote areas. The market may not basically operate the way we would have expected. So in that case, government needs to come in, and maybe government needs to set up public centers in those underserved areas where maybe the private sector won't operate. Integrate with existing initiatives. As we already said, Jordan has national strategy. Jordan has Article 72, where we can see that in the voucher system, we're basically saying that voucher can be used at workplace nurseries too, where we are saying that the employer needs to provide childcare. So it basically gives that flexibility. And of course, for policymakers, it's demand driven. So more women employed faster, greater private sector involvement, and it might be self-sustaining. It can be self-sustaining through the taxation that we basically discussed. Nonetheless, there are some design recommendations that we also have. which is we need to make vouchers user-friendly. It has to be simple to access. The process cannot be complicated, right? If it has to be provided to everyone, that kind of universal coverage needs to be ensured. So that designing is very important, even if it's a voucher system. Sorry, sufficient subsidy and fee regulation, because in many cases we can see that even if the government is providing vouchers, because the private sector is operating, they may increase their prices, and it can still be unaffordable depending on how the private sector is operating. So it is very important for the government to come in and kind of fee regulations and the private sector, that kind of monitoring needs to happen, even if there is a voucher, so that the price caps and the fee regulations has to guide it so that it doesn't make it doesn't get unaffordable still. Ensure quality, as do no harm. Quality is very important. Safeguarding is very important because children will be using those centers. So government needs to have establish and enforce robust childcare quality standards. That's very important, and government's role over there in the quality is will be very important. Support supply expansion, especially in underserved areas. Even though vouchers are provided, again, one of the issues, because we are having a private sector operating, it might be that in the underserved areas, private sector may not open the childcare center. So in those kind of cases, government needs to support those supply expansion and help the private sector to operate freely. Going forward, there are implementation risks as well. Just to quickly go over, there are cultural resistance can happen. We already started this conversation talking about norms. It doesn't mean that if provide childcare means the take-up will be really high. You still can face resistance, and still the use, or as Mari was actually saying, that uptake can still be lower, right? Quality can be a huge issue. If you are expanding very fast, we need to take care of quality. As again, safeguarding is because the children will be using it, quality becomes very important as an issue. So implementation risk can come to that as well. Administrative capacity is very important. How government rolls this out, whether the delays in payments, misuse, all of this needs to be taken care of. Sustainability of funding is very important. You can have voucher system right now, but if you cannot sustain the funding for having universal coverage, that might be a risk as well. If you provide childcare, you need to think about how the funding and how sustainable the funding is. Equity and inclusion consideration is very, very important. If there is a voucher, we also want underserved or low-income households to have the access to this. So designing becomes very important. So that comes as an implementation risk. How to maximize the impact and inclusion. Link childcare with job opportunities. One of the assumptions Mari has quickly gone over and talked about, that we are assuming that if women are coming to the labor market, they can get a job. That actually doesn't happen that way in real life, right? So the job opportunities needs to be connected, helping the women to find the suitable jobs, and job market needs to work that way. Flexible work policies is very important, because one of the study I was actually reading is where a qualitative study where the women said that even if the childcare is provided, they don't want to send their children to a childcare center, because if the child is sick, then how will they use the childcare center, and they cannot go to work. So even then that constraint remains. So flexible work policies also is very important side by side when it comes to childcare. Public awareness is important. Again, we are saying that cultural attitudes matters, norms matters for uptakes. What happens? So this is very important. So include messaging or campaigning that encourages women or men to take paternity leaves, to fathers taking the responsibility, as well as the childcare take up goes into that. Sustainable financing is again important. Alignment with national strategies is something that we need to maximize the impact and inclusion. I will end my presentation here, and thanks to everyone for listening and joining us. We also have put together an annex where you can see what are the benefit categories or the cost categories we have considered throughout this calculation, as well as our assumptions in details, like what we have used. But thank you, and back to you, Jude.
Thank you so much, Tanima and Mary, for the insights. This is great, and we will have some time to discuss. But first, we have with us our guest speaker, Dr. Andres, who is an economist. His research agenda really focuses on just that, understanding the impacts of human capital formation policies with an emphasis on early childhood education. He is currently studying the long-term effects of expanded preschool coverage during the 1980s in Chile. So Dr. Andres will give us his thoughts and insights on the findings that were just presented now. Dr. Andres, please share your presentation and the floor is yours.
Thank you. Well, can you see my screen? Yes, okay, perfect. Okay,
Yes.
so first, congratulations to the Jordanian government for this initiative. I think it's very telling that they are trying hard to make progress in this area. And thanks to Development Pathways for the opportunity of being a referee for your work. They wanted a really independent referee. They didn't give me any instructions about what I had to say in terms of the content, and that shows their commitment to the quality of their work. So thank you for that. So I have a bunch of comments, so I'll move in quickly. So let's start. So this report simulates the consequences of implementing childcare at large scale in Jordan. Jordan has a huge potential for childcare expansion. The number that blew my mind was that 56% of university students are women. So there is a huge scope for incrementing the labor force participation of women in Jordan. The report compares three approaches to providing the service. I think that they take reasonable delivery approaches and a gradual implementation approach that is also the correct one. And they find very, very positive results. So the highest return on investment among the options they consider is for age-targeted vouchers, which has a return of 8.1 social, 2.5 fiscal. So the program pays for itself 2.5 times, which is huge. So general comments first. This is a very useful study tailored to the needs of the government. It addresses critical questions effectively. They consider different scenarios. They are very careful. And also the study is constructive and it's bold. So they are strongly suggesting an alternative, a certain approach, and they're backing it up with their research. So they're not hesitant to give clear policy suggestions, which I think it's important. In my view, the results are somewhat too optimistic, and I am going to focus in this presentation on that area. I would not change the policy recommendation of trying a childcare system with vouchers, but I would caution that the results on child development and fiscal revenue, I think, are a lot more risky than the report shows. Although the report is careful too of trying different assumptions. Implementation is key, as they said. The setting of certain parameters is critical. I'm going to discuss some of those parameters. And in general, I want to say that these are questions that are really, really, really hard to answer. So the report, so it's not a surprise that the report has some limitations, right? This requires a lot of research, a lot of understanding, a lot of data, a lot of causal studies that are hard to come by and that probably don't exist for Jordan. I just want to mention that there is a World Bank report on formal childcare in Jordan that is cited by the study, by the report, that is very useful too, and I am drawing some of the insights and the data from that report. What I want to say to begin with is that in terms of economic logic, there is something that is a little off with the results being so good in terms of both fiscal and social returns, especially if you're just considering money as returns, right? And it's the following. So if the potential impact for maternal work was so large as the report shows, then you would think in terms of the economic logic that a market should develop and should have already developed to privately provide childcare paid by the families. There is not an obvious market failure here. So if there is so much potential, if there is so many people that are willing to to use childcare, if those people are going to have big economic returns in the market, then why the market hasn't developed yet? And so let's discuss those issues. The key parameters that I think that are very relevant and very hard to set because there are trade-offs for all of them are the amount of funding. The more amount of funding, you get more quality, you get more coverage, but you get more expenditures for the government. The strictness of regulation, the report seems to suggest that we go with a minimal non-harm regulation. That is also hard to exactly pin down what is that regulation. Are going to be price caps. It is not mentioned explicitly in the report, so they say there should be price caps, but they don't say how much. Whether it's going to be a geographic prioritization, whether there is going to be socioeconomic targeting, that's very relevant for the impacts on the children, as the literature shows, and whether the government is going to help with infrastructure to the private providers. So all of those are parameters that are hard to determine and that are completely critical in terms of the success of the policy. So my comments are, first, comments about the impacts on maternal work. Second, effects on child development. Third, the profitability of the private nurseries. Fourth, the lack of a deadweight loss of raising taxes. And five, conclusions and policy recommendations. I have already talked for 5 minutes, so I think that I'm going to go really quickly through all of them. So first, impacts on maternal work. Basically, I think that the report is being too optimistic about this. The report seems to suggest that at any price, the take-up is around 80%. I'm not very concerned with that parameter because I think that we're going here through the voucher option. So the parameter that I'm really concerned about is that the report appears to show that all the voucher recipients join the labor force, increasing their probability of working by 70%. In the Excel calculations that I checked, it appears that only 70% join the labor force, with a 70% of them finding employment, resulting in a total employment of about 49%. Any of those two numbers are, in my opinion, too optimistic. Because of several reasons, right? You can have that mothers are already working, so they're intramarginal, and they're using the program as a substitute for informal care or more expensive options. Or you could have that mothers have no intention of working at all, and they are just using the program to free up time. Some mothers might try to work, but they can fail to find a job. So there are many things that could be happening. If you see the literature, and the causal literature in economics is very useful here because they actually show exactly the parameters that we need, that is, within the participants, what is the increase in the labor force participation and in working, and you find estimates that are much lower. So you have Havnes and Mogstad, for example, no effect of childcare and maternal work. I think that's an exception to the literature. Most of the literature shows there are positive impacts, significant impacts, but the impacts are of a lower magnitude. So Nandi find an effect of 6 percentage points. I have a paper with Florencia Lopez-Bo in the Journal of Public Economics in Nicaragua. We find an effect of 12 percentage points. Ayaji find an effect of 35 percentage points. Clark, 30 percentage points. So an effect of 0.49 or 0.70 is too optimistic, in my opinion. The second very relevant point, as Mari was saying before, is that the persistence of the labor force participation effect is critical here for the calculations. And I think that this is the assumption is very, very high here. Because notice the following. So I think that this is thinking, okay, if a mother enters the labor market, she's going to remain in the labor market with a high probability. And that is true. But to get to that 75%, you need that effect to be differential with the mothers that don't go into childcare, because you want this to be a causal effect of the childcare and not just the labor participation rate, right? If the mothers are going to be working anyway when their children go to school, like at age 6, then you are not going to get this 75%, right? And so to maintain this causal effect of 75%, you really need that mothers that did not participate in childcare don't work, and that is something that I'm questioning here. They cite the report cites the ELO simulation, a big report with micro simulations, where they claim that the tax receipts offset 27 to 36% of the childcare costs. And so if that report shows that number, then why is it reasonable here to expect a fiscal benefit to cost ratio of 2.2? That seems very, very high. I'm going to go really quickly through the other points. So effects on child development, I think it's not granted that a program like this is going to have no negative impacts on child development. There is evidence in the literature of programs of this kind that have negative impacts. So regulation is key, but regulation has trade-offs, because if you regulate too harshly, then you have very few entrepreneurs that want to participate. Issue number 3 is that it's not clear whether the private sector is going to be willing to provide like a very large number of nurseries. It depends a lot on the demand. And here we are giving all the risk of enrollment on the shoulders of the business owner. And that includes investing in infrastructure or adaptation of infrastructure. If you're going to be renting, adaptation of infrastructure. And that is very costly. And so that is very risky for private providers. So it's very important to think about whether you are going to have enough supply of slots. Finally, the report doesn't consider deadweight loss. I don't think that's really, really important. We are more concerned about fiscal revenue here, so that would not be a factor in that case. All of these are questions for optimal policy design that I really encourage the government to keep thinking about. I think that this is a very, very worthy initiative, but I think that you really want this to be very well planned and very optimal. And I suggest they take the time to think about all of these complicated issues that are full of trade-offs. And so finally, I just want to close saying that the report effectively highlights the substantial potential of childcare in Jordan. Some assumptions might be overly optimistic. It would be very important to test the results after adjusting for them. The report does make some stress tests to the assumptions, but I think that they should go a little further on that. I strongly encourage the government. So every academic paper, I'm from the academia, and now every academic paper ends saying more research is needed. So I'm going to say the same here, more research is needed. I strongly encourage the government to continue researching these policies, as the benefits of an optimal design could be very large. And I'm very excited to see how this evolves into a national programs, and thank you very much.
Thank you very much, Dr. Andres, for your insights, your critique, and your constructive feedback. I would so we now have some time for Q&A. I will give Tanima and Mari some time to respond, maybe to some of the points that Dr. Andres has brought up, but I would also encourage you to if you have any questions, to list them in the chat, or to maybe raise your hand so that I can see you. Dr. Andres, if you can stop sharing your screen just so that I can see the full list of participants. All right, so we have a first question.
Can I respond a bit to one point that?
Yes, yes, Mary. Just let's take a couple of questions and then give you time to respond to Dr. Andres and some questions. Did the research also target mothers of children with disabilities? I believe more care provision would require mothers. All right, so we have one question in the chat. Until people place their questions in the chat, maybe Mary, if you want to start with your response.
Andres, thank you so much for your very sharp comments. I was expecting something like this. All caveats willingly acknowledged. I just hope nobody would notice. But yeah, no, thank you so much. I think you're exactly right. I mean, a lot of these things are, like I said, we didn't have much sort of hard evidence to go by. I mean, even if there, I mean, something I always think, like, having seen so many RCTs and pilots or this or that, I mean, even those, would they really tell you what will happen? Because there's this story that pilots are always so well designed, and then when you scale up, it works that well. But there was one point that I'd like to say that I actually thought about quite a bit. You might still be right, but there is about the persistence impact. I mean, there is a study I believe using the labor market panel survey, unless I'm mistaken, which does show that in Jordan, like the pattern of women's labor force participation is such that they kind of, after they're married and have children, then they never go back, basically. But whereas those who continue, past that, and I certainly hope I'm not misquoting you, there is a sort of, it's a bit lower than in the other countries that they compared with. There's a certain degree of persistence of that. I think 67% or something like that. Obviously, this is an observational study. It's not a how I said, an evaluation of something that would have been tried to be done to change that. But anyway, I mean, I read it quite carefully. I think Irene Selwanes, Caroline Kraft maybe are the authors. I can send you a link to that. So that was one that I kind of used trying to think through that assumption. So, these are women who would have not been in the labor force, but then they join and then they stay because they are past the critical moment of withdrawing. I don't know, I have something else, but now I think I missed that. But yeah, thank you so much. Very helpful. We will try to polish and check and do all these things that you very helpfully suggested. Thank you so much.
Thank you.
Tanima, is there anything you'd like to add? Yeah.
Oh, yes, Mari has covered it all, but I definitely thanks Dr. Andres to have this comments, because I think those are really helpful for us to also do and check the assumptions. We definitely, as you were saying, the supply side may not, I mean, we are assuming the market will be perfect, the supply will come in, but we also agree that it might not happen. So that's why we put it as a caveat that we are assuming that the market will work perfectly, which may not. And that's why when I was also mentioning about that the government might need to really set up some centers, because there are remote areas where private sector may not perform the way we wanted. The price cap we have seen in the UK, that has been an issue, and many of the civil society organizations has actually been talking about this, that even if you provide childcare where the pricing cap, whether there is a pricing cap or not, because the private sector may be profit motivated, right? So they may charge you more money than whatever subsidies you're providing. So those are the caveats, of course, we agree, and we really appreciate your comments, and we will take care of it as much as we can adjust the model. We will definitely try to do that and make it more realistic. But thank you so much. I think there was one comment in the chat, one question on whether we have considered the mothers of children with disabilities. We actually have not. Mari, you can confirm better because she ran the methodology, but we have not considered it. We kept it as a very basic model so far. The only thing we considered is age differences, which is the age scenario 2, which was the most age targeted one. But of course, these models can always be changed, and different targeting can be done. It can be children with disabilities, it can be with age groups, different things we can try. But in our model, we actually have not tried such things. So I'll stop here. Thank you.
Yeah, I think heterogeneity in general is, of course, something that, I mean, all these disability being very important, obviously, but all these other, like what Andres said about like low income, well, yeah, maybe we should target low income mothers, but then probably maybe the benefit would be also a bit less because they wouldn't make that much contribution to the GDP. But yeah, these are all things that, obviously, in a perfect world, we'd have a perfect model that takes everything into account.
Thank you, Mari and Tanima. A question maybe for Dr. Andres, that since Jordan is now at a crossroads in terms of policy formation and looking at different possible models for Jordan, are there any lessons from Latin America from your research that you see that could fit or could inform the process of policymaking in Jordan right now?
I can just say from my very own home experience in Chile that we have mixed systems for providing most public goods of this kind. And I think it's been a relatively successful experience with nobody really saying we should not have government supply and we should not have private supply anymore. I think it's a consensus that both are important parts of the system. So I think that it's very reasonable to think that in some sectors, you're very interested in promoting labor force participation, but private sector will not go to those places, or it's going to be very hard for the private sector to go to those places because they're just not profitable. And so you need government centers, really like centralized supply. While in other sectors and to have the creativity, the impulse of the private sector, the vouchers model is very convenient and very effective. So I think that it's possible to think about a mixture of both, especially if you are very interested in things developing faster, you can have like a two-pronged strategy where both are advancing at the same time.
Thank you so much. And maybe a last question for Mari and Tanima. I know, as Dr. Andres just said, researchers always recommend that we need more research to inform. But given that you have done, you've gone through this intellectual exercise, you've seen the numbers, you've seen the model, what would be one recommendation you would give in terms of further research and further knowledge generation for the government in terms of, as they are in the process of policy formulation and looking at possible options?
Do I come in first, Mari, or do you want to go? Okay. I can say I think, of course, further research is always for here. The struggle for us was we did not have any primary data. I think government should collect those data. Like we are talking about take-up rates, we're talking about the labor market. You actually don't know. The struggle we had was to collect the primary data. So the government can collect those data actually and fine-tune the model a lot more. As Dr. Andres has also mentioned about it, that government should take this model and kind of really work through it more and look into other aspects of it. So I think that will be very important to collect the data, and also the supply side model, right? What should be the voucher amount? I think that's a question that we also asked, right? What should the quality look like? What should it be? What will make this profitable, right? Whether market will work or not, whether should we have a mixed model or not. So those are many questions that still remains, whether taxation will work or not, whether formal jobs we get or not. So I think government can take this model and go further and fine tune it. And those are the research that will help really to figure out what works for Jordan. I'll stop here and over to you, Mari.
No, I think I've talked enough. I think Tanima summarized it beautifully. And I hope maybe I'll leave it to the others to come back in with some final remarks.
Thank you so much, Mari. To conclude, for closing remarks, we have with us Dr. Ayman Halasse, the Director of the Information and Research Center of the King Hussein Foundation, and also a partner on the study. So, Dr. Ayman, please, the floor is yours to close the session.
Thank you, Jude. I hope everything is well from my side, and please allow me to speak in Arabic, so I will give you some time to switch the channel if needed. مساء الخير جميعا. أول إشي بدي أكون سريع لأنه بديش أخركم أكتر من هيك. بس أنا I have to say this in English. I was impressed that we all abided by time. And this is one of the unique webinars that we are stick with the timing. سادتي وسادتي الله يعطيكم ألف عافية. يعني الموضوع اللي تم طرحه جدا مهم، وبالنسبة للغالبية كأردنيين يمكن هو طرح ممكن نعتبره شوي خارج الصندوق، مع انه في جهود سواء من وزارة العمل او من آه، الضمان الاجتماعي لتقديم هذه الفكرة، اللي هي انه دعم مباشر للمرأة العاملة اللي عندها أطفال. بس بصراحة يمكن الدراسة فتحت جوانب إحنا شوي مش متعودين عليها. آه، ومش عارف، إجتني نوت فضل سويتش. أوكي. شوي مش متعودين عليها، لأنه الفكرة إنك تدفع مصاري وتستنى عائد على هذا الموضوع، وهذا الدفع يتم من الحكومة. للوهلة الأولى راح يكون هذا الحكي شوي في نوع من أنواع المقاومة. أنا راح أحكي بطيء شوي عشان الترجمة. لكن إذا ندرس الموضوع من ناحية اقتصادية ومن ناحية حقوقية، هي ليست تكلفة، هي خلينا نحكي الكلمة اللي تم استخدامها أكثر من مرة، اللي هي استثمار للمستقبل، وفوائده واضح أنها مجدية. يعني ف يعني عندنا مجموعة نماذج، يمكن الأكثر انتشارا اللي هو إحنا متعودين إنه نروح على حضانة أو يكون في مراكز عامة، بس بنفس الوقت فكرة إنه يتم الدعم من خلال قسائم أو من خلال دعم مباشر للأسر. هاي فكرة بسوى إنه يعني يتم دراستها بشكل واضح، وبعتقد إنه هاي الدراسة أولى من نوعها بهذا الخصوص. آه، أول إشي يمكن الدراسة كمان بتعطينا شوية أفكار ليش هذا الخيار أفضل من غيره، سواء من حرية الاختيار بالنسبة للأهل، إنه أنا بختار الحضانة اللي برتاح لها أكثر من إني أكون مجبر بمراكز محددة إلي مسبقا. وهذا لا يعني إنه أنا أستغني عن الخدمات الموجودة، لا، هي موجودة جنبا إلى جنب، هو المواطن له حق الاختيار. آه، أكيد يعني الموضوع راح يكون فيه تدرج، ما نقدرش إنه نشتغل بهذا الموضوع بين يوم وليلة، فبالتالي الاقتراح الموجود بالدراسة إنه نبلش على فئات عمرية معينة ونشوف هاي التجربة كيف بتمشي وكيف تستمر. بس يعني هي فكرة إنه بدنا نتائج ملموسة بشكل سريع في مثل هذا النوع من الاستثمار. لا، إحنا بحاجة إلى وقت حتى نقيس على العائد، وعشان هيك ضروري يكون عندنا مؤشرات، يعني نشوف ارتفاع بنسبة المرأة العاملة، وخاصة أنه يعني تم إثبات، خلينا نحكي أنه موضوع الحضانات أو موضوع رعاية الأطفال هي سبب رئيسي. يعني إحنا في العديد من الدراسات اللي كنا نعملها كان هذا السبب يطلع رقم واحد أو رقم اثنين. غير هيك إحنا مش ضروري كل إشي نعمله نحسبه بالتعريفة وبالقرش، انه انا دفعت هالقد. لا، ما هو كمان في بعد حقوقي انساني لازم ناخده بالاعتبار، اللي هو رعاية الاطفال. آه، وهذا الموضوع يعني باغلب دول العالم وحسب الاتفاقيات الدولية هو واجب على الدولة توفير افضل عناية ممكنة في مثل هذا النوع. وبالتالي انت هنا بتحقق اهداف انه بتحمي الاطفال، زائد انه بتعطي الاهل خيار في اختيار الحضانات المناسبة. على كل حال الدراسة مبنية على أساس منطقي ومدعم بالأدلة وبالأرقام وبالإحصائيات، فبضل عندنا رسائل. هاي الدراسة بتوجهها لعدة جهات. أنا باعتقادي صانعي القرار ضروري يفكروا بهذا الموضوع بشكل أوسع من الشكل الموجود عليه في الوقت الحالي، وأن يتم تفعيل النصوص القانونية اللي بتعالج هذا الموضوع. زائد انه الشركاء الدوليين والمانحين ايضا انهم يركزوا على هذا الموضوع ويعطوه اولويه، حتى نوع من اشكال تعزيز المساواه، خلينا نحكي، وتحفيز الاقتصاد. لانه كمان احنا في موضوع الجندر جاب اندكس، الفجوه بين الجنسين، كمان عندنا لسه ترتيب جدا متدني بالنسبه للمراه. ورفع المشاركة الاقتصادية هو أكيد هدف. وبالتالي هاي الرعاية بتحقق هذا الهدف أو يفترض أن تحقق هذا الهدف. بالنسبة لنا كمراكز بحثية وأكاديميين، يعني إحنا دورنا نعمل متابعة وتقييم لهذا التحول، أو على الأقل التجارب اللي تمت في الوقت الحالي، ونستخدم الأردن كنموذج للمنطقة. يعني نشوف هاي التجربة ونقيس النجاح اللي صار بمؤشرات واضحة متعلقة بالمشاركة الاقتصادية. فبالتالي ممكن أن نضيف للتجارب الدولية اللي إحنا عم نشاركها، وتصبح حالة دراسية تستحق أنها تؤخذ بعين الاعتبار. بالنهاية أنا بأكد على اللي تفضلوا فيه الباحثين، بديش أرجع أكرر الأفكار اللي حكوها، بس إنه رعاية الأطفال هي استثمار قد يكون مكلف بالبداية، لكن إذا ننتظر فترة طويلة أكيد رح يكون هناك عائد أفضل وأقوى مع الوقت. وبالتالي أنا بشكر الجميع على الجهد اللي قاموا فيه، وسعيد إني أكون موجود معكم بهذه الفرصة، وسعيد إحنا كمركز إنه شاركنا لو بجزء في العمل الميداني بهذا الخصوص. فهي فرصة إنه إحنا احتكينا بباحثين وباحثات على مستوى عالي، وهذا أكيد بنعكس بالنهاية على المركز وبحسن من الإمكانيات الموجودة عندكم. جود، أنا ما بديش أطول أكثر من هيك لأنه صارت الساعة 7:30 وبكرة عطلة عنا، فكمان نخلي الناس تروح تنبسط. يلا، شكرا لك، يعطيك العافية.
شكرا كتير دكتور أيمن. Thank you everyone for your time today and for being with us. For those who are joining from Jordan, we know it is late, so we will not keep you any further. Thank you to our speakers, to the research team, to Development Pathways, and to our guest speakers, of course, Dr. Haytham, Dr. Andres, and Dr. Ayman. Many thanks, and good night and good afternoon for those joining from abroad.
Thank you for all. Bye.
Thank you.
Thank you.